September is National Prostate Cancer Awareness Month. Always there are new pieces of research coming into the fray to help diagnose and then treat cancers across the country. We're going to focus on something brand new with CHI Memorial. Dr. Jeffrey Mullins is back on the show with us. He is with CHI Memorial Chattanooga Urology Associates. Good to see you.
Thanks for having me.
I may have misspoken a little bit when I said it's brand new, but it's relatively new. And what we're going to talk about is unique to Memorial. Y'all are the only ones in the region to have this certain type of biopsy, right, that can detect the cancer.
Right. So it's very new to Chattanooga. It's been here for, I guess, going on a year now. It's been around for maybe about 5 years.
Okay.
And it's just now becoming sort of a mainstream way of evaluating a man with an elevated PSA who's had a positive MRI.
Okay, so let's go back to the English major in me and define the IT that we're talking about. The IT is a certain type of biopsy.
Right, so a little bit of background. How we evaluate an elevated PSA usually is with an MRI. And an MRI is great at looking for funny spots in the prostate that may be cancer. The problem is taking a metal biopsy gun into an MRI magnet is obviously problematic. So how do we take advantage of the improved optics and visualization of tumors in an MRI and bring that down to the biopsy setting?
Okay.
And so how we do that is something called a fusion biopsy, where we fuse an MRI image with an ultrasound image. We make a map and then target spots on an MRI using an ultrasound.
So does that mean it's happening simultaneously?
So the MRI images are taken beforehand, and then using this software, the MRI is fused with the ultrasound. The ultrasound has a tracker on it, so as you're moving the ultrasound, the MRI is moving as well, and it allows for targeting, again, an MRI lesion using an ultrasound.
Okay, so perhaps a dumb question, but does that mean then that by having this ability to fuse it, you're able to better detect the cancers and exactly where they are?
Right, so it improves the accuracy of biopsy. So what I do is I'll localize a spot and I'll biopsy that spot. But we already know that prostate cancer typically is a multifocal disease. It's in other places throughout the prostate. So I can also do a systematic or random biopsy. So at the end of that procedure, a man has the maximum information to make decisions about treatment should it be cancer.
Okay, you mentioned this is mostly used for men who come in and have an elevated PSA.
Right.
There's been some conversations that we've had in the course of the last couple of years, I guess, maybe, as to whether those PSA screenings are always as accurate as you'd like to see. So it's good just to always know if prostate cancer runs in your family or something, that this is available.
Right. So PSA is not the best screening test, but it's the best test that we have. And we make PSA a much better test by using things such as MRI to evaluate men, because it doesn't involve a biopsy. So in 2018, we're doing less biopsies, we're diagnosing less clinically insignificant cancer, and we're just focusing on the things that could really impact a man's life and leaving the other stuff alone and doing it in less invasive ways. But when a man gets to the point of needing a biopsy, it's imperative to do the biopsy in the best available way. And my personal opinion is that fusion biopsy is the best way to do it.
Are you finding that more and more men are realizing the importance of screenings and kind of stepping up to say, okay, I'm going to be in charge of my health?
No, I
think he's an honest doctor.
The wives are, though. Usually, you know, if you can reach a man's wife, she'll bring him into the office for evaluation. But you know, PSA is an important part of screening, as is, you know, colonoscopy and other things like that.
So talk about, I guess, warning signs and preventive measures.
That's the problem. There are no warning signs, and so if a cancer has no warning signs, you have to screen for it. If it becomes symptomatic, oftentimes it's too late to offer a man a cure. Prevention, there's no one thing you can do to prevent prostate cancer, but in general, exercise, healthy diet, don't smoke, all these things help.
The basics.
Yeah, reduce inflammation in the body, reduce your risk of having numerous types of cancer, and if you do get cancer, improves your outcomes with treatment.
Okay, if anybody's watching, they have a recent diagnosis and they want to, or they're afraid that there's been a spot seen, and they want to have the biopsy. Can they come to your office on their own? Do they have to have a referral to come and see you?
Just give us a call.
Okay, let me tell you how you can do that, because it is Chattanooga Urology Associates. They're housed right there on Glenwood Drive at the main campus for CHI Memorial. Their phone number 697-0072, online at chimemorialmedicalgroup.org. And it's Dr. Jeffrey Mullins, who you had the pleasure to hear from this morning. Thank you so much.
Thank you.